Some emergency medical services staff in Khayelitsha have downed tools demanding personal protective equipment against COVID-19. They say they can't be expected to protect patients if they aren't protected. For more on the story, we're joined by our reporter, Ronald Masinda, live from Khayelitsha in Cape Town. Ronald, tell us what's happening there and a little bit more about their anger and their demands.
Yes, a very good morning to you from Khayelitsha Hospital, Jane, where EMS service workers have really been up in arms, saying that the Western Cape government has made them empty promises. They've been on strike since Saturday, and in and among the PPE equipment that they do require are N95 respiratory equipment, surgical face masks, face shields, goggles, just to name a few, Jane. But for more details, we are joined by two staff members, Charlotte Clark and Snathemba Ngiti. Charlotte, I'm going to start off with you. First of all, why do you think the Western Cape government has not met your demands? And also, can you give us a demonstration as to what kind of equipment do you need?
Good morning. Yes, first of all, I need to say this. We've asked our director to come down to the floor, and he refused. Our plea to them is for proper PPE once we go out there to be protected. This is what EMS, what our management feels is proper PPE according to them. It's the visor, the mask, the apron and the gloves. We do that for COVID, positive and suspected. And tonight, we must go home with our uniform back to our families. Exposing our families, exposing ourselves, and even the community. This is what we're asking them to please give us. And they're refusing to give this to us.
Snathemba, I'm going to bring you into the conversation because earlier on you had a meeting with your district manager, and we couldn't help but to overhear that there have been threats of, should you guys decide not to work, that you won't be paid. Just tell us more what emerged from that meeting.
Yes, that's correct. Our employer, they told us if we don't work, and then which means we're not going to pay, we're not going to get paid for those days. So, however, we still stated that we want our demands to be met. The demands are not coming from the TAMSAC information. It is stipulated on the Western Cape guidelines, COVID-19, that each and every emergency care workers, they need the N95, they need the A40 suit that we must work with. And then the apron, it's not feasible to work outside the hospital. So, however, our management, they've changed those guidelines. And then we asked who changed the guidelines. We wanted the head of department to come. Unfortunately, they said no, they cannot.
Why do you think those guidelines have been changed, though?
We really don't know. We were not consulted. But on Saturday, the shift that was working Saturday morning, they came here. There were no gloves, there were no masks, there were no A40 suit. So they were told them to go and service the community without the proper PPE.
Charlotte, this certainly does place you guys at risk from this virus. We also know that there are reports that a number of cases of staff members being infected with COVID-19. Can you tell us more? What information do you know, and is it information that is made clear to you as staff members?
Currently, we're going on hearsay, we're going on suspicion. It's not concreted being informed to us. But what we've heard, that there is, so far in the metropole itself, 5 EMS staff that has been tested COVID-19 positive. What happened to them, who they are, where they're being isolated, we don't know, because there's nothing in place for us. If you contract the virus, you're being sent home to your family, or you're being forced to remain on duty. So we don't know what is happening currently.
Snathemba, in closing, where to from here if your demands are not met?
We are waiting for the meeting that is going to be 10 o'clock today with the Dr. De Vries, our director. However, he refused before to meet the employees. He said, we must work or we must go home. And then today he said he's going to do a Zoom meeting, and then we're waiting for that Zoom meeting with our union reps. If the demands are not work, we will continue struggling, and then with the process of striking until our demands are met.
All right, Jane, well, those are the concerns from EMS staff here in Khayelitsha. Also saying that there are about 5 reported cases of staff members who have contracted COVID-19. What we also heard last week from the Western Cape government is that one member of the health sector, a nurse, passed on. She died from COVID-19 last week. So that certainly goes to prove that no one is immune to this virus. We'll also be speaking to the health department after 9 o'clock.